Well, my question is, when I think about a possible move to a single payer plan, we'll use that term, I immediately think that the biggest obstacles will be the health insurance and pharmaceutical companies. And is there any way that they would allow, and I use the term allow, and I'm confident that's the right term, a single payer plan to exist in the United States?
Obviously, the health insurance companies would be hurt tremendously, but they're the ones who've gotten us into this trouble in the first place. I think like the way Medicare is run now, the health insurance companies provide Medigap insurance, and I think they could provide Medigap insurance. These would be specific plans that they would be allowed to offer. So we could cut down on the complexity of having thousands of different plans with thousands of different levels and all kinds of different benefits, where people don't know what benefits they have in their plans. They don't know what they can do and what they can't do. The single most important cause of bankruptcy now is medical debt. About 2/3 of bankruptcies are because of people's health care costs have bankrupted them. And that goes for foreclosures also. A tremendous number of foreclosures are because of medical debt. We're the only developed country in the world that has these kinds of things. It has to end.
I think that Barack Obama misplayed this from the start, and I think a much better strategy for him would have been to say from the beginning, what I want to do is, as a test, expand Medicare and expand Medicaid to cover people that are, a broader age range and a broader income range. And he would have accomplished something that would have, number one, if it works, provide much more clout to do what he originally said he wanted to do, and would actually have accomplished something that would be a little closer to a single payer system. What would you think if he had gone that route from the start?
Well, I think his emphasis on doing it quickly was a mistake. I think first he had to educate people to the problems that exist, because most people don't know that we're in an unsustainable system right now, that the country is going to go bankrupt if we keep increasing medical costs. We can't sustain things. The hospital trust fund of Medicare is supposed to go bankrupt in 7 years. We have unfunded liabilities of Medicare and Medicaid that are in the tens of trillions of dollars that the government is obligated to pay and the taxpayers are obligated to pay. People don't know those kinds of things, and they don't know how much unnecessary care is being done. I think if they were educated to these facts, they would be more attuned to change the right way. This never occurred, and I think this was very important. I also think that he should have said, I have a fiscally responsible plan. We're going to reform health care, and it's not going to cost the taxpayers an additional dollar, and there's not going to be any additional government spending, because we can afford a tremendously good health care plan, and we don't have to spend any more money.
Well, there is not agreement about. There have been a lot of organizations that have fact-checked that statement from Barack Obama's recent healthcare speech, and there is not complete agreement that it would not. There's different numbers, and I know that you present some in terms of what can be saved by eliminating infrastructure, so on and so forth. But it is not completely clear to all nonpartisan groups that we could really do this without adding to the deficit.
Oh, absolutely true. They don't talk about the incentives. They don't talk about the unnecessary care. If we're talking about 30% of, by the way, the CBO, was the Congressional Budget Office, was the one who estimated that 30% of care is unnecessary. This was a nonpartisan group, and it was based on a lot of work that came from the Dartmouth Center for Clinical Evaluation. So if we're talking about 30% of care being unnecessary, we're talking about $800+ billion. If we could cut down 3/4 of that, we would have more than enough to fund a health care reform and universal coverage. The estimates for universal coverage probably are about $100 billion a year. We're talking about $800 and some odd billion a year that we could save.
Well, let me mention again, we're speaking with Dr. Robert Levine, author of Shock Therapy for America's Healthcare System. My last question for you today, do you believe that by the end of the year there will be some kind of plan passed?
I do. I think the Democrats really feel it's important to get something passed, no matter what it is. Unfortunately, I don't think it's going to address the issue of cost. I think there probably will be some sort of universal or near universal coverage, but it's not going to take care of costs. And if the issue is going to have to be revisited again in the near future, because we can't afford any other we have to do something that's going to rein in costs.
We've been speaking with Dr. Robert Levine, author of Shock Therapy for America's Healthcare System and practicing neurologist in Connecticut. Thank you so much for calling in today, Doctor.
Oh, thank you.
Well, Lewis, it's a grim situation, and I believe that there's one thing that I think everybody can agree on. Well, maybe not. Actually, no, I take that back. But that I think is very key, which is that I don't think a lot of people realize the extent to which the healthcare financial situation, forget about how good is the care, just the financial situation is a burden on the economy.
Right. Obama has mentioned not as much as he should, apparently, excessive care. But, it seems that neither the Republicans nor the Democrats really seem to be talking about the overall costs thing and the sustainability problem.
I think you're absolutely right. Let's move on to a few other things.